So without further ado, I would like to invite Melissa.
Okay, good afternoon. I realized that being post-lunch and the last speaker is not so enticing. Okay, so I wouldn't take too much of your time. I think everyone has been listening. So I like how you all actually, organize this program, from a very happy topic from childhood cancer, and then a grimmer topic on finance and the challenges, and suddenly to the marginalized populations of Sarawak. So again, I'm a Sarawakian. I'm from east side of Malaysia, if most of you do not know where it is. Okay? So I'll just give a very brief introduction about the burden of breast cancer in Malaysia. So my mom was affected with breast cancer and she was late diagnosed. Okay, so this is why we're doing what we're doing today. 50% or actually more of new diagnosed breast cancer cases are actually late stages 3 and 4 in the whole of Malaysia and also Sarawak. 6.7% received the diagnosis within a month, and this is the ideal time to get them diagnosed to treatment, and only 6.7% is within the ideal time range. 73.3 per 100,000, this is the mortality rate of breast cancer in our country, which is the same as ischemic heart disease, one of the highest burden of disease in the world. And our country's 5-year survival rate for breast cancer is 67, one of the worst in the Asia Pacific region. Yeah, that's why I said the topic gets grimmer and grimmer. Yeah. All right. So, situation in Sarawak. So this is the challenges that we have in Sarawak. So over here is, I cannot point. So this is Peninsular Malaysia, right? Okay. So this is Peninsular Malaysia and this is Sarawak. Okay, so we only have one public tertiary hospital in the whole of Sarawak, so which we need people to travel all over here to get to Kuching to get treated for radiotherapy and chemotherapy. And we have 3 million population and over 30 ethnic groups. Imagine speaking in 30 different mother tongues in my country, right? 45% of our population actually live 100 kilometers from the urban cities, okay? And we have only 4 government hospitals equipped with diagnostic mammogram facilities. Okay, so what concerns us? Definitely the 45% who are living very far away from complete cancer care. Sarawak is very big, okay, and the 30 mother tongues that I was talking to you about. All right, negative influences, there's still a lot of stigma going on, urban and rural regions, all right, and poor recognition, poor awareness, and of course, like what Professor Lee just mentioned just now, financial burden. So I have been actively involved in a few NGOs. So this is one of the NGOs that we are actively involved in. It's called the Sarawak Breast Cancer Support Group. So this is a preprint, okay, in peer review right now. So we have actually outreach to all these women in rural areas in Sarawak. So we have covered over 2,000 women in about 42 villages all around Sarawak for the past decade. Okay, so and this is these are findings which will be published soon. Okay, so we dive deeper. So that is just an overall, okay, of the villages that we did. So we dive deeper. We went into a qualitative study analysis. So we decided to speak to these women of indigenous races. And we tried to explore their cultural belief influencing them from getting early screening and treatment, especially for cancer. I think it works not just for breast cancer, it probably works for any other type of diseases as well. To access the accessibility of breast cancer screening in rural Sarawak and to explore behavioral interventions to promote early screening and diagnosis. As what Professor Lee mentioned, early diagnosis is always better because treating patients at late stages incurs more financial burden. Okay? So the setting, we did a 7-month study. So we locate villages more than 100 kilometers away. So we actually went to 3 main geographical terrains, so Borneo coastal, riverine, and highlands, so many mountainous areas. So our rivers are infested with crocodiles, yeah. Yeah. And sometimes you don't have any life jacket or so it's a bit scary for us to go in. Okay. So we interviewed women aged 20 to 70 years old, permanent residents of all these villages, and our sample size was determined through saturation principle. Semi-structured topic guides were developed, and in-depth interviews were performed. All right. And we'll analyze all this. We analyzed all this data, and 5 key themes were identified, which I will highlight next. So these are the profile of all the women that we have interviewed. So each village we interviewed 5 women. Okay, so we interviewed the ethnic minorities: Bidayo, Melanau, Iban, and Orang Ulu. 5 of each. So most of them are actually their income, most of them are Christians, 85% are Christians, okay, the rest are pagans. 80% of them have an income average of 500 ringgit only. That's like about 160 USD average, household income. Yeah, most of them are not working, housewives, and they are farmers. Okay? So this is the thematic drawing. I'm not going to get into the detail, just to prove to you that we did our analysis. Alright, so now let's go to the exciting part. So theme 1, local myths and beliefs. Alright, so this is Lut Bawang ethnicity. So you can see that all of them actually has some kind of herb as a treatment. So you can see this one here. I know there is only one type of herbal. If they eat it, cancer can't happen. Yeah. They refuse to show me what it is. And then the other one says that they use medicine such as oil. They massage the oil several times on the breast, and it will cure cancer. It will cure breast cancer. Okay, only when the condition gets worse, then they go to the hospital. Alright? Another one says radiotherapy is too harmful. Yeah. So this woman has seen their friends dying after treatment. Okay, so there is a misconception. So sometimes the late diagnosis is not the treatment itself that kills the patient. It might be late diagnosis, but they are not aware. So, and then it hinders them even more from getting treatment. So they go for oils and herbs and trees and all that, okay? Alright, next one is stigma and taboo, which is theme 2. See, embarrass. Breast is a sexual organ. Okay? Most doctors, unfortunately, are men, especially in the rural areas. Okay, girls don't want to go rural area, right? Yeah. So sometimes men, and then they refuse to go to primary healthcare because when they see a man, they don't want to go anymore. Okay, so they don't want to talk about it because it's a sexual organ until it gets really, really bad. All right. Then the next one is that this one, spirituality. When you are diagnosed with breast cancer, you are not clean enough. This person is not good enough. Therefore, they hide it. Okay? And yes, see, they think traditional medicine is more effective than chemotherapy and radiotherapy. So there's still this misconception. Now, theme number 3. Lack of knowledge and awareness. Okay, when I asked them about BSE, they said, for me, I only do it once or twice a year. What is worse, they were not referring to BSE, they were referring to pap smear. Yeah. When I asked them, do you know what is BSE? Ada pap smear. Yeah, so because, why? Because Ministry of Health focus more on pap smear than breast, than CBE. Alright? So another misconception. When we asked about mammogram, not even one of them had mammogram done before. Okay? The one that almost had mammogram done before were only 2. And one said that, I had registered, but my husband was admitted to the hospital, so it was cancelled, and she never get it back again. So you can see how the women in the rural areas actually prioritize their family's health before theirs. Either their children or their husbands. And they always put theirs at the back. Second one said, I went to private hospital A, but when I got there, my mammogram was broken. And then so she never get back there, because there's a cost. Right? There's the out-of-pocket cost that Prof. Lee mentioned. They have to spend a lot. Remember, they only earn 500 per month, or maybe less. And some of them spend actually 1,000 just to get out to Kuching. Okay? Risk factor, they always guess the age of their friends that had breast cancer, or the age of the friends that get sick. Alright, now access. Okay? You saw the 4 mammogram places, right? If one rosak, how? Kan? Takkan ada pergi tempat lain, kan? So there may be difficulties due to distance, transportation costs, financial and other expenses. I need to transfer to RTU SGH, this is Kuching. Okay? If we want to do examination at a private hospital, it would cost a large amount of money, which they cannot afford. This is the first one. Another one says, they go refer to clinic A refers to clinic B refers to hospital A, and that's the cost. Okay, so there's like so many, the navigation system is not too great. Okay, and coupled by geographical challenges. Okay, and then the other one is, we are having a hard time leaving our children behind. Again, putting other people's health first before theirs. The last one, okay, not all is grim and dim lah, okay? Yeah. There is a silver lining. All of them stated that they are interested to learn more, but they are illiterate. So giving them brochures will not do you anything. You just be killing trees. Okay, they can't read. Right, so we need to think about other ways to educate them. And remember, 30 languages, mother tongue. Give them BM, maybe they don't understand. Give them Chinese, they don't understand. Right? So we probably have to use other methods, videos, or maybe something else. Okay, so in summary, there are still deep-rooted cultural myths among the marginalized populations of Sarawak, right? And despite this, all of them have interest in learning more, which is a good sign, okay? And moving forward, we need to localize health literacy materials to rural communities, provide more creative awareness campaigns through visual aids, and to demystify the disease. And lastly, we have to deliver educational content in local languages, such as Bahasa Sarawak or local dialects. Okay, so these are just, of course, it's not as easy as it seems, okay, because deep-rooted cultural beliefs are very hard to uproot. All right? I think all of us have culture inside us as well. I also have. My mom has a lot of bantang. Even until now, as a modern person, I'm still influenced by her. All her cultural myths and all that. Okay, although I don't believe it, but certain part of me still will think about it. Okay, you will think about it. Okay, whether you like it or not, right? Okay, so just to keep you all excited, okay, I only have the 8 minutes left for now. I will show you, for me, I think I can talk the whole day, but patients' voices is the loudest, okay? So I'll be showing you a brief documentary that we have actually videographed throughout our whole outreach program. So this is a trailer, so it's about 4 to 5 minutes, so just bear with me for 4 to 5 minutes.
punya cái ngu su của bìa của bà. Yan, ako na nag-awo, inaw sa palado. Yes, kaya ba? Saya cakap dengan dia sendiri, kalau saya tak boleh terima, siapa nanti anak, kalau saya pergi, mudah-mudahan makcik keke, makcik tak hidup lama.
The reality today is that who you are and where you live actually determines if you live or die. And because we have over 30 entities in Siaw, but they have their own local dialect. So the language barrier is definitely there. In order for them to go to hospital, we don't have a public transport. Some villages are even forced to travel via a 4x4 four-wheel drive over logging roads.
The poor conditions of the road also hamper accessibility of these communities to town.
The gap affects everyone, and we can change this. Ignore the tarik because I have an old video. Alright, so I'd like to thank you. I would like to give a special thank to UICC for sponsoring this project for us. And so I would like to end my session by emphasizing that where you live should not determine if you live. Okay, and rural populations are most likely to be diagnosed at later stages than the urban population, let alone appropriate treatment to ensure their chances of survival. So it is our duty as patient organization groups to make sure that no one is left behind and that they can see many tomorrows. Okay, with this, I thank you for your attention.